I think the first disconnect that I've seen when I first became director was the lack of knowledge, the lack of appreciation what Indigenous peoples face.
Je pense qu'il y a encore certains préjugés et oui, on essaie de faire des améliorations et avec le programme autochtone, on discute beaucoup de cet enjeu-là.
In the past, we weren't even allowed to attend medical school without giving up our status, for instance. Now, we're progressing to a state where we're valuing both sides of the coin.
I remember when I started in 2005, it was a broom closet that, was our resource center.
When I did my med school here, there was only one afternoon of Indigenous health. But for Indigenous people, traditional medicine is a core of our being that's been done for thousands of years.
We're starting too late in instructing learners and exposing learners to that difference between traditional medicine or holistic ways of knowing, but at least we can try and minimize harm that occurs and try and integrate it with the support of allies, because of course we can't do it ourselves, and truth and reconciliation can't happen without all of us. It is a social and cultural change.
Here at the medical school, we're working towards reconciliation in addressing Indigenous health curriculum, teaching, as well as admitting Indigenous students in the medical school to become physicians. So I became director of the Indigenous Program in 2010. I brought my memory of being a medical student, what it was like. How can I support those Indigenous students in the medical school when I didn't have much at all? I was the only self-identified First Nations student for 4 years while I was here.
I can't imagine being the only Indigenous person in my class, right? And kind of having to navigate, medical school alone, really. I'm happy that Dr. Kitty didn't succumb to the pressure, kind of persevered, because now I'm surrounded by Indigenous students, I'm surrounded by Indigenous staff and non-Indigenous staff who are incredibly supportive of me. So I became a lot more confident and within my friend group, and that also extended towards my actual studies.
When learners come into the institution, our goal isn't to give them a book and say, this is traditional medicine, because that's the kind of Western colonial way of thinking, that everything can be documented. Instead, from an oral history, from an experience perspective, you have to live it, you have to feel it.
Traditional medicine looks at balance and wellness and incorporates quality of life and what is important to that person who is ill.
In my language, we say Mino, Bimaadziwin, which is essentially living the good life. And for everyone, for all of us, it's going to be different.
One of the main pushes of the Indigenous program is cultural safety. That involves building relationships with Indigenous patients, relationships that are safe and free of racism.
J'ai une patiente autochtone aujourd'hui. Elle me disait qu'elle avait de la misère dans les soins de santé en étant Première Nation. Puis quand je lui ai dit moi-même que j'étais Première Nation, elle s'est sentie plus en sécurité pour être capable de me parler de ses problèmes.
I think it prompts all medical students to think about Indigenous peoples, their realities.
Quand je regarde les autres étudiants de ma cohorte, je vois une certaine ouverture d'esprit que peut-être qu'il n'y avait pas avant. Ça nous permet d'ouvrir les portes, la compréhension, la sensibilité.
And this will serve them well in any patient that they're helping, whether they're Indigenous or not.
Now it's been reinvigorated. Now we're doing more. Now we have an opportunity for more change.
I have this Indigenous Medical Learners Association that's been developed within the past few years where I can pursue projects that are meaningful to me.
On a eu une rencontre récemment, puis on parlait déjà des choses qu'on pourrait faire pour améliorer le curriculum.
The learners are rejuvenated, they are integrated, they're inspired.
I know personally, once I come out of this program, because of the support that I've received, I'm going to go to Indigenous communities and practice medicine there and try to relieve some of the healthcare challenges that they're facing. And I know a lot of my other Indigenous student colleagues are going to do the same.
And that's what we've been able to achieve here in the Indigenous program, is building that sense of community again.
We've produced 100 Indigenous physicians from various parts of Canada who have progressed to residency, and some are now practicing.
I think I almost owe it kind of to the program to be involved, just because of the support I've seen, the opportunities that I've been able to participate in. I want to kind of pass all that down to future medical students.
Je suis positive et effrayée en même temps. On a beaucoup de travail devant nous, puis ça peut effrayer, mais j'ai hâte de foncer puis de pouvoir changer les choses.
If we're able to carry that momentum forward, we'll get to a place that, well, I don't think we can ever be satisfied, but we'll get to a better place.
What mostly brought me to the position was to remind myself and the students, what are you learning this for? It's because you're going to be helping Indigenous patients and you need to have this knowledge and the attitudes to address racism, dismantle it, and give care with a kind heart and an open mind.